Hello, partnering for vaccine equity learning community members and others working to advance vaccine equity. My name is Kristen Brown, and I am the Deputy Director for Group Learning for the learning community. On behalf of our team at the Urban Institute and our partners at the CDC, thanks for being with us this afternoon. We know that the PAVE learning community members are eager to use data about the communities they serve to plan their vaccine equity strategies and tailor program activities. The PAVE Data-Informed Technical Assistance Team provides hands-on support to PAVE partners so they can do just that. Today's learning session spotlights how 3 learning community member organizations have worked with the Data-Informed Technical Assistance Team and used the resources they provide to improve and enhance their vaccine equity work. Before we go further, I'll do our typical review about how this session will work. First, we offer live interpretation from English to Spanish during our events. If you would like to listen to the Spanish language channel, simply click on the globe icon in the Zoom taskbar at the bottom of your screen. You've all been muted upon entry to this session. If you have a question for our speaker or panelists during the presentations, we ask that you use the Q&A tool in the Zoom taskbar to submit it. We'll also have a dedicated time for questions and answers at the end, when you can also ask your questions live. Just use the raise hand feature at that time and we'll take you off mute so that you can speak. The chat room feature is also open today, and we encourage you to use it to introduce yourself or comment on what you are hearing. However, please try not to put your questions for the speakers and panelists in the chat because we might miss them there. Submit them via the Q&A instead. If you have technical difficulties at any point during the session, send an email to our community manager's inbox at vaxequitylearning@urban.org so that we can assist with troubleshooting. Finally, as with all of our learning events, we will post the slides and a recording of this event on our community website and circulate them through the digest that go out through the CDC Managed Adult Vax Program listserv, which all paid program members should be a part of. Now it is my pleasure to hand things over to the members of the Data-Informed Technical Assistance Team for today's presentation. These team members include James Lee, Ryan Ferreira, Giovanna Brown, and Eve Lee. Thanks for joining us today. Giovanna, the floor is yours.
Thank you so much, Kristen. We appreciate it. Hello to everyone on the line. Thank you so much for joining us today. My name is Giovanna Brown. I am part of the Data-Informed Technical Assistance Team. I'm joined today by my colleague, Eve Lee, who will be facilitating our question and answer session. We are so excited to be with you today for the Spotlight on Using Data for Vaccination Planning and Outreach webinar. We have some great speakers for you to hear today. But before we start, we want to give you a high-level overview of the session for today. We are going to talk a little about the Data-Informed Technical Assistance Team, which many of you are familiar with. Then we will introduce our speakers for today. There will be a question and answer session after each speaker presentation. Eve will moderate this session for each session afterwards. So please use the Q&A feature. Following the last presenter's Q&A session, we will close with some reminders, feedback surveys, and announcements. As you can see, we have a jam-packed hour, so we really appreciate you taking the time with us today. As many of you are familiar, the Data-Informed Technical Assistance Team is part of the Partnering for Vaccine Equity program. We support all of you to use data to support your vaccine outreach confidence and uptake planning. You may recall us providing tailored data reports tailored to your priority populations and areas of focus from various data sources. Additionally, we provide training for publicly available data tools that empower you to continue your planning. During this webinar, presenters will share their work and how data has helped them inform their vaccination planning and outreach. We are so excited to introduce our 3 presenters today. They represent organizations that are doing amazing work in using data to inform their vaccination planning outreach. First, we have Corinne Reyes. Corinne is the Director of Health Equity at YWCA San Antonio. Chelsea Rome Nedlick. Chelsea is the Supervising Public Health Educator at Broome County Health Department in New York. And finally, Joan Enderle. Joan is the Director of Public Health Program Implementation at the American Heart Association. As a reminder, please put your questions for each presenter in the Q&A box. There will be time at the end of each presentation for them to answer your questions. And without further delay, I will pass it over to our first speaker, Corinne.
Okay, I think you can see and hear me now. Awesome. Well, thank you guys, everybody, for joining us. My name is Corinne Reyes. I am the Director of Health Equity here at YWCA San Antonio. I am an African-American female with short brown hair, and I'm located in my cubicle at work here. A little bit about YWCA San Antonio. There are many YWCAs all across the nation. We are not affiliated with the YMCA. We have a very unique mission statement, and that is to eliminate racism and empower women. And here at YWCA San Antonio, we do that through our core programming. And that includes things like childcare, youth services, and our food pantry. We also have some very interesting programs like economic empowerment and workforce development that we utilize to ensure that all the women that we serve and all the families that we serve have all the tools they need to not just survive, but thrive. I am a registered nurse by trade, and I come to this work through many years in the hospital, just wanting to do more for the community and just, happy to be here helping others to access care. You can go to the next slide. So here at YWCA San Antonio, we have a vaccine strategy that utilizes a bilingual educational material model, and that is enforced by our community health workers. And here in Texas, we call them promotoras de salud. That is like the official name we typically utilize in Texas. Our promotoras work with local organizations to host vaccine events. So since we are not a vaccinator ourselves, we typically will work with several other community-based organizations and vaccinators, including the health department, to kind of formulate these events. Another method we use is pop-up clinics in really high concentration areas. And they may seem like unique areas for a pop-up clinic, but they actually work very well. And these are some things like flea markets, apartment complexes, even like the community, like the neighborhood hubs and in a lot of the communities. Those are really great areas for us to host clinics. And also we work very closely with the Mexican consulate to offer like a variety of immigration vaccines in addition to COVID vaccination. We work with a community health worker to make sure that they educate each individual and provide safety and efficacy information on all the vaccines, as well as just kind of promote like a holistic well-being model as well. Now, how we've kind of come to this model is by utilizing the reports and analysis that were provided to us by DITA. And some of that includes like the zip code analysis that was carried out. It helped us to kind of identify those areas that we needed to focus on the most. So when selecting which flea market, which apartment complex to go to, the zip code analysis helped us to kind of hone that in. We're also able to like strategically position pop-up clinics in areas where we noted that transportation was an issue. Those we kind of get a little bit more micro with those clinics. We want to put them like as close to the people who need them as possible when transportation is not available. And in San Antonio, Texas, there's like essentially no public transportation. So that's really, really crucial for us here. They also helped us to understand what demographic we're struggling with going ahead and getting vaccinated. So for instance, if we're looking at an older population that's having a hard time getting the vaccine, we may go visit senior centers more frequently than we go visit elementary schools at that time. And then we also kind of like bridge and merge this data with data that's available to us from our local health department. You can go to the next slide. And then these are some examples of the promotional material that we utilize here at YWCA. On the left-hand side here, you see a picture of us doing a vaccination clinic at another local community-based organization called Impacto Comunitario. We work very closely with them very frequently, and you see our community health worker, Maria Quintero, here in the orange shirt on the far left, and she's our lead vaccine educator. She's actually standing behind me right now as well, but here in the middle is just kind of an example of the social media outreach that we do. We utilize specific hashtags to target certain audiences, as well as specific tags to make sure that we connect with our partners well. And then on the right is just another example of a flyer that we would pass out in the community to kind of get them interested in coming out and getting vaccinated. Here we do feel pretty strongly about utilizing class standards, which have to do with the health literacy component. We do provide all of our materials in both English and Spanish, as you can see, both from the social media post, which is in English and in Spanish, and as a flyer, because the population that we serve is 80% primary Spanish speaking. So that kind of like wraps up our program and what we do here. Do you guys have any questions for me?
Thank you, Corin, for your
Yeah.
presentation and sharing.
And
I am looking at the Q&A. I don't see any questions yet, but participants definitely feel free to put your questions in Q&A, and I can raise them.
awesome. Well, thank you guys. And yeah, looking forward to the next presentation.
Oh, I see one. I see two actually. This question is, how do you set up with apartments, and do you talk to the PM?
The PM being like the apartment manager or
Property manager.
property manager. Yes. Yeah, we do talk to the property managers directly. They will typically first give us permission to post flyers on the doors of their residents. That's the first step there. So we're going to flyer the entire complex about 1 to 2 weeks in advance of the event. You don't want to go like too early on because people will forget about it. And of course, you want to give a little bit of time for planning. So about 1 to 2 weeks before the event is when we will go flyer the entire community. After we flyer the community, then we will host the event, and if the community center, like typically all apartment complexes will have some type of like community like gathering center, like a pool house area or a gym where you can kind of post up there. If not, another place that we've gone, and when that's not available, is literally just in the office, like the primary office where they would go drop off their checks or go talk to the property manager, and we've literally set up in that office right there, and that's typically pretty convenient for most people.
Thank you, Corin. We also have another question here. How do you go about curating the information shared during the vaccines at Impactio Comunitario? What are the materials you are sharing?
So it's going to be, like you said, is based on the population. So at Impacto Comunitario, they have two primary clientele that they're serving. Part of it is going to be your primary Spanish speakers, and then we have a very large Pashto community here as well. So knowing that first and foremost is going to kind of dictate what material we're serving, because immigration vaccines are slightly different than what you would get at your everyday clinic visit. So if we are going to be dealing with people who are part of an immigrant or refugee population, we need to know what vaccines they need to get in order to stay in the country. And then we just tailor it like that. We kind of figure out like who we're talking to. Is it a back to school event? Are we going to be talking childhood vaccines? Is it going to be a bingo night and we're talking to seniors at night? We're going to probably talk about shingles. We always wrap things like COVID and flu vaccination around other vaccines that also need to be given. It just, the information is kind of just taken a little bit better when it's done that way.
Thank you, Corin. I see another questions here, and I can probably partially answer this too, but wanted to get your input. It says, how do you receive reports from data? Does your program run the data, or do you request it? So you can definitely request it from our team. I will put our email in the chat, so you can feel free to send us an email if you would like to talk further about the type of data support that we can give you. Oh, thanks, Giovanna. And I think to add to that, we also actually have a question for you, Corin. What kind of recommendations do you have for other organizations in terms of using data for vaccination planning and outreach activities?
Sure. I always like to first start with the fact that data is not black and white, it's gray. So you really have to know your community first and foremost. And that's why we utilize a community health worker model. Our community health workers have a very deep grasp on what exactly the needs of the community are. Just because data tells you that transportation is lacking in X area doesn't necessarily mean anything if you don't understand what exactly what's going on in that community. Maybe that's a very walkable neighborhood and transportation outside of your feet is not necessary. Or maybe it is a big deal. So you really have to, one, know your community well. And if you have community health workers that you can work with, I would strongly recommend that. And number two, if your health department has data as well, I think that's the strongest place to merge data points from, because health department data is typically of the minute, and it's going to give you a different feel about what is going on in the community.
Thank you, Corin. I'm actually curious, can you elaborate a little bit more about the data that you request and get from the local health department?
Yes, well, yeah. Our health department, Metro Health here, actually posts their data every Tuesday. And so they post everything from who's getting vaccinated in terms of like age, demographics, like what neighborhoods. They have neighborhood mapping from GIS as well. I'm very lucky that our health department has such a comprehensive data system, and they do post it publicly every Tuesday. And I know that's not something that's offered everywhere. So
that's really great to hear. I'm glad they have such great data.
Yeah.
Do we have any other additional questions for Corin? Well, hearing none right now, definitely feel free to continue to put your questions in, and we can, of course, circle back in the end if we need to. But at this time, I think we can turn to our next presenter, Chelsea.
Yes.
Thank you, Corin.
Hi, everyone. Can you hear me okay?
Yes, we can hear you.
Okay. My name is Chelsea Riom-Nedlick, and I am a supervising public health educator at Broome County Health Department in New York State. Giovanna, can you show the slides, please?
Chelsea, are you able to see the slide?
No, I cannot. Okay, there we are. Can you go? Perfect. All right. So as I mentioned, I am with Broome County Health Department. We're located in New York State, kind of on the border of Pennsylvania. It is not New York City. Many people hear New York and they just think New York City. I'm a supervising public health educator. My picture is here on the slide. I am a white female in my 30s with glasses. I'm coming to you from my office today. And the mission of Broome County Health Department is to serve our residents by promoting and protecting public health through education and prevention. And we do that through a number of programs. We have a clinic that actually sees patients for sexually transmitted infections, immunizations, tuberculosis. We have an environmental health division that, inspects restaurants, water quality, things of that nature. And I oversee a number of programs, but today I'll be speaking about the work that we've done under the PAVE grant. We are a Scope of Work B grant recipient, and I can tell you a bit about what we have done with that funding on the next slide. All right, so our PAVE funds have been used to launch a large media campaign, which has been informed in large part by local data. So we actually already had a very robust community-based COVID-19 vaccine program utilizing other lines of funding and staff. So when we received our PAVE funding, we decided to use that towards a local media campaign, which would be very targeted to our community based on data, community surveys and interviews, and which would actually depict places in our community to give people a real connection to the ads. And so we started by conducting a rapid community assessment, or RCA, where we worked with communities and partner agencies that served our priority populations to ensure that we got adequate representation. So our priority populations for this project were urban Black individuals, urban Hispanic individuals, and rural white individuals. And so we set about surveying folks from those communities at community events. We also partnered with organizations such as meal sites and a primary care practice to speak to folks who serve those communities to get some insights into what it has been like working with those populations and those populations' feelings on COVID-19 vaccination and influenza vaccination. And then once we had gathered all of that local level data informed by people in our community, we then received our DITA report, which was very informative about some higher level data on areas where people are more likely to get vaccinated for flu, less likely to get vaccinated for flu. And we also looked at some New York state level COVID-19 vaccination data that breaks out COVID-19 vaccination rates by zip codes. So armed with all of that information, we worked with a local ad agency to produce a COVID-19 and flu promotional ad campaign. And we aligned the messaging of that campaign with results from the RCA, local data, and some academic literature. We had an intern that was working on this project who was a really great source for not only analyzing the data, but also compiling the literature and giving some suggestions on, effective messaging to the ad agency. And once those ads were produced, we distributed them through a number of local media channels. We did billboards, bus shelters, radio ads, TV ads, and some limited digital display. And as I mentioned, our data reports were part of the mosaic of data that informed placement of billboards and bus shelter ads in Broome County. Using those data reports, we were able to hone in on physical locations in the county where people may need to really hear the messaging about how important it is to get vaccinated for COVID-19 and flu, that may need additional education on the severity of the disease. And we ended up placing those items. The billboards, 2 went up in downtown Binghamton, which is the largest urban area in our county, and 2 went up in Whitney Point, which is one of the more rural areas of our county. Broome County is a mix of urban and rural. And then 2 billboards went up in Endwell, which is a more suburban area. And then finally, bus shelters, 2 ads went up on the west side of Binghamton, 1 went up on the east side of Binghamton, and 1 went up in the village of Johnson City, which is an urban village. Next slide. All right, here we have some photos of the ads that were posted. The first one on the left is a photo of a bus shelter, which was posted in Johnson City. And that is an ad reminding people that it's not too late to get a flu shot. The second ad is in the middle. This is a bus shelter that went up that's on the east side of Binghamton. And that is giving the messaging that it's not just COVID. We hear this from people a lot, and it was reflected in the surveys that people filled out, that people really didn't think COVID was a serious illness. So we wanted to provide the messaging that it's not just COVID, it's serious. And the picture shows 3 cartoon people of different ages, genders, and races, all with Band-Aids on their arms because they just got their COVID vaccine and they're super happy about it. And then the last photo here is a billboard, again, with that flu ad. It says it's not too late, get your flu shot, and it has a ringing clock on it. So those are some snippets of the static ads that we did. We also did radio ads and TV ads, like I said, and those actually depicted local people. So it was filmed, there was voiceovers by local people in front of local businesses, visiting a local nursing home in one case. So they were recognizable individuals and places that might resonate with people who are viewing it because they know the person or because they know the place, and it might ring a little bit more genuine or relatable to them. And I'm realizing I should have attached a screenshot of those commercials, but I didn't, and I apologize. So that's it for my presentation. If anyone has any questions, I'm happy to take them.
Thank you, Chelsea, for your presentation, and thank you for including these images. They're really great to show kind of the types of information that you guys have to tailor to your community. As audience post their questions in the Q&A, I don't see any right now. But you mentioned that Broome County is a mix of suburban and rural areas. I was wondering if you could speak a little bit more about how you strategically plan around the different areas, the rural areas, and if their strategies might be different.
Yeah, that's a good question. So we have Binghamton and Johnson City and Endicott, which are kind of, I would say, the urban core of the county. It's a city and 2 urban villages. Then we have some suburbs. And then outside of that, we have some very rural areas. And so we used the same technique, like the same platforms to advertise to the rural folks, but we use slightly different messages. So if I had the commercial or the radio ad, I could show you. I apologize for not including those, but the rural one was an older gentleman who was white, who kind of looked a little bit, I don't want to say, he looked like more rural, I guess, like he had on a flannel and like he was on a farm. And the concern he was presenting was about like protecting those around him rather than like, is it the, quote unquote right thing to do? So we use some of the messaging that was identified as like gaps that people had based on the surveys that we did.
That makes sense. What other recommendations do you have for organizations when using data for their vaccination planning?
I echo what Corinne mentioned. Get out there and talk to your community, get to know your community. The survey that we did, the rapid community assessment, and the key informant interviews that we did with our partner organizations was immensely helpful, especially into digging in on the why people were choosing not to get vaccinated and the beliefs they had about vaccination. That was really helpful in crafting the messages that we gave to the ad agency. And then they were able to bring those to life in some really high quality ads that we hope to use in the future as well.
That's great to hear. Are there any other questions for Chelsea? Hearing none right now. I think we can see if there are more questions towards the end, but thank you again, Chelsea, for your wonderful presentation. And I think we can turn it over to Joan.
Well, hi, everyone. I am Joan Enderle with the American Heart Association, Racial and Ethnic Approaches to Community Health, known as REACH, awardee in El Paso County, Texas. I use she, he, her pronouns, and I'm a middle-aged white woman with short brown hair sitting in my office with the American Heart Association logo in the background. In my position as Director of Public Health Program Implementation, I oversee and manage the REACH grant in El Paso County, Texas, including the COVID-19 and flu or influenza vaccination for adult supplement funding. Next slide. El Paso County is in the westernmost county in the U.S. state of Texas. Mexico is to the south across the Rio Grande River, and the state of New Mexico is to the west. The county has a population of about 870,000 with a total area of 1,000 square miles. El Paso, the city of El Paso, is about a fourth of the area, about 240 square miles. And the city of El Paso is the 6th largest city in Texas and the 22nd most populous city in the United States. So as you can tell, there's a very urban area, the city of El Paso, and then there's also extremely rural areas. Our priority population of focus is for our grant was adults, Hispanic or Latino, which constitutes almost 83% of the total population. And also Black and African Americans, which are 4%. Both of those populations, we're looking at those that are experiencing systemic, social, and health inequities. Of note, nearly 70% of residents speak a language other than English at home, primarily Spanish. Our outreach activities, including engaging with the community members to understand their concerns and perceived barriers to vaccinations and to create solutions. Based on those initial conversations, assessments, and primary barriers that were identified that were needed to overcome to increase vaccination, including the cost of vaccinations. Now that, of course, was specific to flu, while COVID vaccines, 19 vaccines were free. Travel, at convenience and the time, and trusted locations. A number of families in El Paso have mixed immigration. And so there is a concern with government officials and also locations that vaccines are given, that they be trusted. As noted, our second outreach strategy and activity is to locate mobile vaccination sites in accessible and trusted locations. And in some examples were schools, churches, bus hubs, and we really had over 50, over 100 different vaccination sites over the grant period. We also used tailored social media messaging placed in priority zip codes, along with other types of communication. And our fourth outreach strategy was leveraging trusted messengers, which in El Paso, in our priority populations, were healthcare professionals, promotoras, which was noted earlier, are community health workers, community leaders of organizations to disseminate accurate information. And while in El Paso, there is somewhat a level of distrust of the government, we found that they were very receptive and felt CDC was a very trusted source of information. For our tailored messages in El Paso, again, as I noted, Spanish language was used for almost all messages, or they were both done in English and Spanish. We used a local translator for transcreation because language that is culturally and linguistically appropriate needs to be personalized or individualized to the region. see. The next thing I wanted to do is talk about how did we use the data reports and other data-informed planning. The American Heart Association is a science-based organization, and the data is the basis, or is it used as part of the basis for all decision making. So first, we use the information of the data team to determine where there were like vaccine deserts, or where were there areas or zip codes or gaps in standing vaccination locations. So we looked at where were the pharmacies, where were the federally qualified health centers, where were the locations of the city and county health department and others that were providing vaccination, both individually for flu and for COVID-19. Now, those maps then helped us look. We also then looked at who lived in those areas and were they within our priority population. We also use layered maps to identify neighborhoods with elevated health risks as identified by CDC for those who were at higher risk for death from COVID-19. Also, income, multi-generational households, uninsured rates as it relates to where we needed to provide free vaccinations, and low vehicle access. And that helped us prioritize vaccine events and communication. So those maps were used for both. Those maps looked at trusted locations. So not only once we identified a neighborhood, we know that convenience was a key for our populations, for the individuals we were trying to reach. So we looked at where were food bank or food pantries so that we could have vaccination events there. And our food bank was willing to look at adding food sites in those population or those neighborhood levels. Mentioned schools was one of our #1 partners. Schools are a very trusted location or trusted organization in our community, and all schools hold vaccination clinics on site for children. And they were willing to open those while they were there vaccinating the children, they were willing to open it up for parents, grandparents, or anyone in that neighborhood. And so the social media was used to promote those vaccination sites and locations. El Paso County has a high percentage of individuals with smartphones and access to social media. We also worked with the bus system and having vaccination sites at transfer stations, the outlet mall, which happens to be in one of those priority neighborhoods that were identified, along with drive-through vaccination sites for both flu prior to the COVID vaccine and then vaccination, vaccinating over 600 individuals per hour at some of those events. And again, for communication, we used it for our social media. We used it for our bus and bus shelter campaign identification along with billboards. And we also worked with, used the maps on historic influenza under vaccination rates with partners for planning, including a presentation that they used to go to the county commissioners for allocation of funding for free flu vaccine. So in year one, they had money to purchase up to 100,000 doses of flu vaccine or influenza vaccine, and the second year similar mapping and reporting resulted in them getting funding for 35,000 free flu vaccines. And I guess not noted on my presentation, but we also worked with other partners on the maps, including Reduce the Risk, which was a county collaborative, and they used the maps to determine where to along with local data, to where to send the promotoras to educate and provide resources in the community. Next slide, please. Here is just a few of photos, and I'm just going to talk about a few of them. We did a combination of communication campaigns that were kind of more general about flu and COVID, and others that were more specific to populations that we had identified either as low vaccine uptake or high need. So in the upper, this slide has photos on 2 rows. I'm going to start just with the photo on the upper right, which is a photo of a pregnant Hispanic woman with the young girl facing the woman with her hands on her stomach. The wording on the top is, as you grow your family, being vaccinated can protect your loved ones. Get vaccinated for COVID and flu today. This was used in physician offices and a number and social media to reach out to pregnant women. The next photo to the right is a man with a mask holding a clipboard next to a car, taking registration information for a drive-through vaccination event, which I talked about earlier. And the top center is a photo of Father Jose Morales, who is a Hispanic Catholic priest in his office. Father Morales is a trusted messenger who videotaped a program that we called To the Heart of Health, which is done in both English and Spanish, as you can see by the title on this slide, To the Heart of Health, in both English and Spanish. It is a 5 to 8 minute conversation type, very casual, and shared on social media and YouTube. And these types of messages were very well received with high interaction. And then the top right photo there is a female Hispanic promotora wearing a mask, handing a young masked woman face mask and hand sanitizer and information outside a storefront with a table in front. And then the last photo there on the top right is a billboard that was focused on senior citizens with a Hispanic couple with the man's arm over the woman saying, don't risk it, get your COVID vaccine to ensure the best protection possible. Find free vaccine near you at vaccines.gov. That is the end of my presentation, and I will turn it to Eve for questions.
Thank you, Joan, for your wonderful presentation and sharing all these images. Really love the variety of graphics you have here. I see 2 questions in the Q&A so far, and I think they actually might be similar, so I'll pose them to you together. One is, can you repeat or clarify, you said that the community did find the CDC trustful? And the other is, hey, Joan, thank you for sharing. How did you determine that your community members trusted the CDC more than other government organizations? Were surveys used, or was this more intuitive?
No, it was based on surveys. We did surveys in 3 different ways. First of all, we did some, and I'm not sure what it is called exactly, but it's our communication consultant. They did a type of social media survey where people could respond to, and it asked them specifically, it provided them with a list, and it said, who do you trust? And CDC was the second item selected, always behind local healthcare professionals. So, and other type of government officials were not ever checked. It was, and the second was we did focus groups, both in English and Spanish. And we also did focus groups with our a Black African American population, which in El Paso is typically one of two groups. They're very concentrated in where they live near the Army base. And so it's usually individuals who have moved to El Paso who are military and or retired. And they also, and the Spanish and the English speaking groups all always trusted CDC. The only the Black individuals, CDC was number 4 as far as they're trusted, but for the Hispanic, English speaking and Spanish speaking, CDC was always 1 or 2, was always 2. And then the third was with our promotoras. Our promotoras did community outreach, as I was talking about in the pictures, not only handing information, but they actually did surveys. And one of the questions was, who do they trust? What messages do they believe? And again, CDC was rated, and all of those types of things very near the top.
Thank you, Joan. Do we have any other questions for Joan in the Q&A? I don't see any right now, but you can still put them in the chat, put them in the Q&A section. While we are waiting for questions, Joan, I have one for you, and this is one I've asked other presenters as well. What other lessons or recommendations do you have for other organizations when using data for their vaccination planning and outreach?
The first thing I would say is to actually make sure that identify your audience you're trying to reach is really the important thing, because if you don't know who you're trying to reach, then you don't know necessarily what data to look at. And then the other lesson that I would say has been most successful for us, as I mentioned, is look for companion partners, activities based on the data for zip code area. So like I said, you know, we really used that data, and then we looked at, well, who's in that area? Because as noted, the American Heart Association is not a vaccinator. And so we worked really strongly with partners. So whether it was the school, the food distribution, the shopping mall, the grocery stores, the church, the bus transfer station, and maybe think outside the box. And the data for, and to use the data for partners beyond just for your use for the vaccination. And so we worked with the data team and actually had them come and do a training to how to use some data maps and what data was available, so that once the grant ends this fall, that those partners can continue to use data and use their own data or use the data sources.
Thank you for mentioning that, Joan. Definitely, if your organization is interested in looking at how you might be able to use publicly available data tools to inform your planning, like Joan said, we are here for you, and you can email us through that email address inbox that we put in the chat, and we're happy to set up a one-on-one training session with you. I think we might have time for just one quick question, last question for you, Joan. Just looking ahead, what are some of the strategies and activities you're planning for the fall and winter? Are there strategies that you're looking to continue based on past experiences that's worked well? Are there new strategies that you're looking to pilot and try out for the first time?
Well, one of our new strategies, which builds on a previous strategy, is because healthcare providers because healthcare providers are such highly related, trusted messengers, we this year worked with physician clinics on materials that were already developed by a collaborative on how to make a strong vaccination ask for physicians. So we hired a healthcare expert who had experience with working with physician clinics and had them visit physician clinics with the materials that included posters and we did 3 groups. We used general family practice type settings. We used the ones who worked with the new moms pregnancy, as I mentioned, the poster, and then also cardiology offices, of course, related to the high that individuals with heart disease and a history of stroke are at high risk and should be getting, of course, flu and vaccines. So this fall, we are launching actually in August a campaign about the high dose flu vaccine for seniors and physicians' offices, along with a communication plan that shares the information that seniors should receive the high dose flu vaccine. And along with that recommendation, it also they should be receiving it in October. So that is a new campaign that is launching end of August, beginning of September, focused towards physicians' offices and posters and communications. And then there'll be a community component also.
That's great. Thank you, Joan, for sharing those. I'm looking forward to hearing more about how they go. And I think since at this time, we might be trying to turn it back over to closing, but I wanted to just thank you again, Joan, for presenting, and also thank you, Corin and Chelsea as well. Back to Giovanna. Back to you.
Thank you so much, Eve. Thank you to all of our presenters. Such great information you shared with us today. And thank you all for joining and asking amazing questions. Just wanted to plug here also, in addition to the one-on-ones that Eve mentioned that we can provide, the Data Informed Technical Assistance team is also offering office hours next Wednesday. So that's Wednesday, August 2nd from 1 to 2. So we can throw that registration in the chat. But this offers an informal opportunity for you to ask us any data top of mind questions that we can answer based on things that you are planning, or as Joan mentioned, some future things that your organization is looking into. So you do have to register for this. Again, we will put that registration in the chat. And if you have any other questions, please use the Data Informed TA at cdc.gov email to reach out to us. And with that, thank you so much on behalf of the DITA team. We appreciate your time and participation today. With that, I will hand it back over to Kristen. Thank you.
Well, on behalf of the Urban team, we would also like to thank all of our presenters and participants for today. We do want to plug a couple of our upcoming events. We have one more event this month. It is the second session in our 4-part series on vaccine equity for people with disabilities. It'll be on Monday, July 31st at 2 p.m. And we will put that registration link in the chat. We also have our regularly occurring orientation session. This brief overview of what the learning community has to offer and how to access group learning opportunities includes a live demo of our website. And the next one is on August 3rd at 2:30 p.m. And we will also put that registration link in the chat also. Lastly, the satisfaction poll should have just popped up on your screen. So please fill that out, as it helps us to inform and decide upon future events. And with that, we thank you all for joining us today and enjoy the rest of your day.